Leprosy is a neglected tropical disease which still occurs in more than 120 countries, with more than 2 lakh new cases reported every year. Do you know India is currently running one of the largest leprosy eradication program in the world, the National Leprosy Eradication Program. Despite this, 11 lakh 4,451 new cases of leprosy were reported in 2019 in India. This is 56.61% of the global total of the new cases. At Medicircle, we are conducting an exclusive series on the occasion of the World Leprosy Day. Through these series, we aim to create awareness about leprosy and share the views of individuals and organizations that are doing commendable work for leprosy patients. Hi, this is Sana Khan, and today in this initiative, we're going to speak to Dr. Nitin Sampat. Dr. Nitin Sampat is a senior neurologist at Wokhard Hospital, Breach Candy Hospital, Bhatia Hospital, and Global Hospital. He has been into practice since 38 years now. His special interest is in headache, migraine, stroke, and clinical electrophysiology. Hello, Dr. Nitin. Welcome to Medicircle.
Hello, a pleasure being with you here. Uh, in view of the World Leprosy Day and as you said, with the mind-boggling figures that you mentioned about the
Right.
persistence in our country,
Mhm.
I'd like to make a point that I'm quoting figures for India
Okay.
from the literature in 1985. Where they said that there were almost 30, prevalence was almost 36 per 10,000 people in India at that
Oh,
time. And now it's supposed to be considerably lesser after the efforts of the WHO in the 2000s, where they tried to eradicate the disease completely. And
mhm.
well, they failed to do it, but at
Okay.
least they eliminated the disease to a considerable extent.
Right. The numbers have been drastic numbers changes.
That's right. That's right.
Okay.
But leprosy, as you know, is
Mhm.
eminently curable,
Okay.
chronic disease.
Right.
Now it is prevalent in many pockets all over the world, but its highest incidence is in India, Brazil,
Mhm.
and parts of Africa. Although you can see pockets elsewhere, especially in the tropics and subtropics.
Right. Okay.
Bangladesh, China.
Right. Dr. Nitin, what is your contribution to the benefit of leprosy patients and towards the eradication of leprosy in India?
Yeah. Well, I had carried out a trial
Mhm.
many years ago on the early detection of leprosy cases. I mean, I would go and examine the suspected cases who are not proven to be leprosy and carry out nerve conduction studies or clinical electrophysiology, as I mentioned to you. And a
Right.
particular aspect I was studying was what is called the F waves.
Okay.
F waves are late spinal responses. And I tried to do a study, okay, whether we picked up very early the nerve involvement in cases who are suspected to be leprosy and not yet proven to be.
Okay.
Um, as far as see, it's this leprosy, as you know very well, is divided between the dermatologists and the neurologists.
Right.
The the tuberculoid type or the borderline tuberculoid type
Right.
would come to us much more with nerve problems,
Right.
as opposed to that just the skin problems would go to the
Go to the
dermatologist who
dermatologist.
manage the treatment.
Right.
So, although we did not actively treat, but we were doing it in collaboration with dermatologists
Mhm.
who would subsequently carry on the treatment.
Okay. Dr. Nitin, India has eliminated leprosy as a public healthcare problem in 2005. It has re-emerged in different states with high intensity. What do you think were the drawbacks?
The biggest drawback is socioeconomic problems and
Mhm.
nutrition, but it can be overpopulation also. I mean, family with 12, 15 members staying all together,
Right.
the father cannot provide for all the children, so nutrition suffers. And because the socio-economic problems are there, the financial problems are there, they cannot provide the best this thing to their children.
Children.
I think that is the main thing. Furthermore, if one member gets leprosy
Affected.
and
Hmm.
the others are in contact with the house being small and so on,
Right.
although 90% of the contacts develop resistance on their own, they have they can get infected, but not they don't manifest the disease.
Right.
But the 10% of those others who are there have a 5 to 10% almost 15% chance of developing leprosy vis-a-vis the common population.
Okay.
So I think that is the biggest thing that leads to it. Not in India, but in Mexico, armadillos or the chimpanzee or the monkeys in Africa
Okay.
carry the disease, and they can transmit the disease to humans. So
Oh,
that may be a source of infection. That doesn't happen in India so much, but
right.
armadillos are much more in certain parts of the world, and there the leprosy coming up again is pretty much higher.
Right. Hmm.
I
Okay.
think these would be the common factor. Furthermore, I would say that although the vaccine was available, people did not take the vaccine, or the BCG, Bacil Calmette Guerin vaccine for
Right.
tuberculosis, was
Hmm.
taken at birth very commonly in our generation. But
Right.
now the tendency is not to take it routinely, because how much protection it gives protection from 20 to 80% in leprosy.
Hmm.
But there are papers which suggest that the BCG should be re-given to the patients who are likely to be contacts of leprosy cases.
Leprosy cases.
There
Right.
was a particular vaccine that was tried there, that was being developed in the past, where a live attenuated form of M. leprae along with the BCG was tried, but
Mhm.
it was not pushed further because probably the
Okay.
early results were not very good.
Right.
Then chemoprophylaxis is also known
Okay.
in contacts.
Hmm.
Suppose the father has leprosy,
Okay.
and the mother, the child, the son or the daughter have it, then chemoprophylaxis in the form of rifamycin, 600 milligram, can be given to these people, to the
Okay.
contacts,
Right.
and but the efficacy of that is not very high
Right.
and lasts for a shorter time. So that also is not routinely practiced.
Hmm. Okay. Uh, Dr. Leprosy continues to be stigmatized in India. What measures do you think are required to dispel it? Also, what are the preventive measures one could take to stop the spread?
Uh, See, Sana, in even epilepsy is a stigma.
Right.
Epilepsy, that is fits, seizures, which
Right.
I treat. Now,
Hmm.
and it's much more in young girls than in boys.
Okay.
Because when it comes to the time of marriage, straight away they say, "Arey, usko to akli hai." So they
Right.
don't like to take that.
Hmm.
But in epilepsy, we always advise our patients. For a second, I'm diversing. I mean, going away from the topic. I always tell them to explain everything to the in-laws. Otherwise,
Okay.
they harass the girl later.
Right.
Similarly, I know it's a big stigma.
Hmm.
Leprosy is a big stigma in society. But
Right.
the myths have to be taken away from the minds of people, because it's eminently curable if caught early and treated.
Right.
So therefore, this stigma must be removed from the people's mind. But this is done more by NGOs and people, health workers, who go from house to house and
Right.
explain to the people, okay, this is curable.
Right.
Well, the first thing is, if any white patch or
Hmm.
erythematous patch, red patch, where
Right.
you can't feel the sensation is missing,
Hmm.
or or they don't get sweating at that place,
Okay.
things like that, then report to your doctor immediately, and then probably meet a dermatologist or a neurologist
Mm-hmm.
and get it sorted out with investigations, and therefore start treatment early
Right. The
once the
early stage
diagnosis is
in
made.
early stage diagnosis and investigation must be very important.
Correct, correct. Then
Hmm.
to improve your nutrition so the body can fight the disease.
Okay.
The immune system, if it is the cellular immune system, if it's high in an individual, then the chances of getting the infection are much lesser. Number three, just like in COVID, avoid direct respiratory droplets from a infected patient.
Right.
However, in patients also excrete it in the urine, in the stool, in the
Right.
breast milk, and so on.
Okay.
So if the patient is affected, some restrictions are to be made on those
Mm-hmm.
individuals uh, for feeding the child, or not passing urine or stool anywhere, and so on and
Okay.
so forth.
Mm-hmm.
Because after the bacillus is in the atmosphere, it persists for some period of time.
Oh, all right.
So
Mm-hmm.
if you take these particular steps, I think you can achieve to some degree. Uh, and of course, awareness of the disease should be spread to other
Mm-hmm.
people. Where if you see a
Right.
white patch, where you can't feel, then you
Right.
must report it. Then a slit skin smear can be done, or
Okay.
an EMG can be done, and early diagnosis can be made and treated. I have
Okay.
seen quite a few patients being overtreated.
Okay.
They had I had recently a doctor, about 6 months back. She went to some doctor with a slightly hypopigmented patch,
Okay.
and without doing any investigation, that XYZ doctor started anti-leprosy treatment for 6 months.
Okay.
And when I examined her, I did not find any evidence. I mean, you would say it could be cured, but she found out she had taken photographs and this thing and other features to show that it was there. And incidentally, she had been seen about fourth or fifth month. She had been seen by a neurologist who did not find any thickened nerves or any I mean, anesthetic patch there.
Right.
So probably it was overtreated.
Okay. Okay. Dr. Nitin, the vaccine for leprosy is already developed. Is it a required immunization for children? If not, why do you think it is not included in the list of required vaccines?
Well, it's not the vaccine that the literature recommends is not specific for leprosy. It
Okay.
is it is for tuberculosis,
Right.
but it
So
has
BCG
efficacy
vaccine?
from 20 to 80%. Sorry,
You
BCG,
right, BCG vaccine, right.
BC,
Hmm.
Basil Calmette Guarin is the name.
Right.
Now, its efficacy is about 20 to 80%, not 100%.
Okay.
However, people recommend that if once it has been given, and if the patient is in a contact with leprosy cases, then a second dose should be given.
Okay.
But that's why it's not included in the protocol. To okay, these are the things to prevent. As
Right.
I mentioned, chemo prophylaxis also has doubtful efficacy and short
Hmm.
duration, and therefore it's not routinely given to people.
Okay.
Today, in view of the Leprosy Day, I wish to talk on this chronic curable disease that is eminently treatable if and does not cause complications if caught early and treated fast.
Okay.
It's a chronic curable disease caused by Mycobacterium leprae.
Okay.
This affects skin, nerves in the majority of patients, but lesser so it can affect the eyes, causing blindness, the testes, causing infertility, and the kidneys, where there's amyloidosis in lepromatous leprosy. It's most common in males between the ages of 15 and 29 years, and
Okay.
often results in residual deformities. And that's why it needs to be treated early, and even care should be taken after treatment is over to prevent complications like deformities, where the bridge of the nose might collapse, the ears
Right.
might be affected, pinna, and the hands might claw. In 2000, it was believed that only Mycobacterium leprae causes it. But in 2008, from Mexico, there was a diffuse form of disease with increased morbidity and mortality. And it was found that it was a new species,
Okay.
Mycobacterium lepromatosis, which caused it.
Okay.
Now, the exact clinical manifestations and the immune reactions of this new bug is not known, and it is not accepted as a etiology of for leprosy in all countries.
Okay.
Epidemiology is worldwide in distribution. As you rightly said, it occurs in all countries, but right now it's predominantly concentrated in the tropical, subtropical countries, India, and Brazil being the most affected, although Africa is affected in a big way. Uh, the armadillos or the African chimpanzees or monkeys may be vectors because they transmit the disease and pass it on to humans. Mainly, it is spread by respiratory droplets and ulcerative lesions which the patient might have.
Okay.
It has a temperature predilection. Usually, it lies cold temperatures. In India, it is about 32 degrees. In India, the temperature is usually higher than that. So, this would be more at 32 degrees, and therefore, it affects the anterior part of the eye. It affects the front part of the testes,
Hmm.
but does not affect the viscera in the abdomen.
Okay.
It has a very long incubation period of months to about 5 years for tuberculoid leprosy and up to 10 years in lepromatous leprosy. And as you can see in this photograph, can you see that?
Right. Yes.
This is the deformity that can develop after a treated patient because he does not have sensation.
Okay.
So it gets affected, and this can be a permanent residue. The other reasons are leprosy, there's resorption of the soft tissues and the bones, and so you can get these deformities. Plus
Right.
they get repeated infection. So
Hmm.
keeping the wound very clean and preventing infection is very, very important.
Okay.
What are the risk factors? Usually, there is a genetic susceptibility. Why certain and resistance also is because of the genes. Certain people are affected, others are not. Home contacts with Mycobacterium leprae have 5 to 10 times increased risk of developing the infection.
Right.
Now, leprosy is divided into several types. There's an indeterminate type of leprosy where you might get one or more lesions which is not very well delineated. It's hypopigmented, there's sensation loss in that area, but uh, because of the inflammatory response that the body gives due to the cellular immunity,
Hmm.
it may just pass off and you may not have to treat it. The tuberculoid
Right.
leprosy has, again, it's a paucibacillary. So it has less than 5 lesions, but the
Hmm.
borders are elevated,
Okay.
and you can take a biopsy from that. As opposed
Hmm.
to the lepromatous type, has multiple lesions which are symmetrical,
Okay.
and they go on to affect the face, the nose, the ears, and so on. Now, coming to the subtypes of leprosy. Leprosy divided into paucibacillary, that is the
Hmm.
tuberculoid variety, and the other end of the spectrum is multibacillary, that is lepromatous leprosy. But there are very many borderline cases in between. Uh, so you can get a borderline tuberculoid, a borderline lepromatous, or a borderline. And
Okay.
there's a neurotic variant, very rare, which affects only the nerves, not the skin.
Okay.
There, the nerves are thickened, it causes nerve abscess, and autonomic features are present, not only sensory, not only sweating loss, but even other autonomic features. As you can see, in the borderline tuberculoid, the cases are maximum, then the
Right.
tuberculoid. These cases are luckily very rare.
Okay.
Clinical manifestations can be a wide spectrum
Mm-hmm.
depending on the parasitic host relation
Right.
and the cellular immunity of the host. They can be isolated nerve lesion. That's how they present to us neurologists. Single nerve or mononeuritis multiplex. In fact, the most common cause of chronic mononeuritis multiplex in the tropical countries is Hansen's, that's leprosy, or it can be collagen vascular or very rarely diabetic.
Okay.
It can also cause systemic disease, can affect the liver, the spleen, or it can be on the face.
Right.
It may affect the eyes and cause blindness, which is one of the complications. Initially, there's a sensory loss only in that area, but subsequently, a sensory motor peripheral neuropathy can develop, and that because the underlying big nerve is affected, and because of that, you get a glove and stocking hypoesthesia.
Mm-hmm.
However, in neuropathies of other etiologies, the reflexes are lost very early, but in leprosy, the reflexes are preserved till much later.
Right.
Now, initially, the nerve lesion is an axonopathy.
Okay.
This occurs more in borderline, usually is most common in borderline cases or in tuberculoid variety. Then it can go on to develop a mononeuritis or mononeuritis multiplex, which is axonopathies. But subsequently, when the Mycobacterium leprae enters the Schwann cell, which produces the myelin to go in the neuropathy, then the demyelinating neuropathies may occur with slow conduction. Normally, the conduction, say, in the median nerve is 48. Below 32 would be more likely demyelinating neuropathy,
Okay.
or that can be a temporal dispersion or conduction blocks, which I shall show you in the next slide. Now, this is a normal response. When you stimulate at the wrist, then you get the first response, and at the elbow in the median nerve, you get the second response. But you can see the height of both these responses are the same.
Mm-hmm.
This is what a normal neuropathy, the normal nerve would show.
Okay.
However, when there's a demyelinating neuropathy, one, it is delayed. The latency here and here, you can see there's a big, and the waveform is much smaller in height and is spread
Right.
out. This is called temporal dispersion. Sometimes it will be absent, and then there's a conduction block. This is normal. Comparatively, this is the affected nerve.
Okay.
Pathophysiology. This is an intracellular microorganism.
Mm-hmm.
It is recognized by the antigen. In the dendritic cells, the antigen presenting cells catch this, and those are dendritic cells, macrophages, monocytes, fibroblasts, and Schwann cells, which causes the neuropathy. It causes a local inflammatory response, and that might reduce the M. leprae in tuberculoid leprosy. However, if the Th2 type of lymphocytes are affected, there's a cytokine. This is adapted
Okay.
immunology. Cytokine stimulation, suppression of macrophage activity, and insufficient immune response, which is usually seen in lepromatous type of leprosy, to combat the M. leprae in the macrophages in the lepromatous cases.
Right.
I'll not talk on the pathology. Investigations. What investigation do you do? First is clinical.
Okay.
Hypopigmented patch, which is anesthetic. There
Right.
are thickened nerves, and there may be deformities in the hands. Then the
Mm-hmm.
EMG nerve conduction studies, which I showed you, with the late spinal responses, the study which I had done in early leprosy cases.
Okay.
Bacilloscopy, that is split skin smear, with bacteriological index is studied, because then as you are treating the patient, you can come to know whether the bacteriological index is changing or not. Then skin biopsy, nerve biopsy, and the polymerase chain reaction. These are all tests to diagnose leprosy.
Leprosy. Okay.
Treatment. Like there is an MDR tuberculosis, that is multiple drug resistance, or an
Mm-hmm.
XDR, extreme drug resistance, and the patient does not respond to rifamycin or isonex. Even in leprosy, you must look for drug resistance. Normally, dapsone 100 milligram daily with rifamycin 600 milligram once a month. Uh, 600 milligram once a month,
Okay.
and this is bactericidal, whereas clofazimine is bacteriostatic. However, if there's resistance, then ofloxacin or minocycline or pfloxacin can be used.
Okay.
Dapsone, this is in tuberculoid leprosy and for 6 months. But in lepromatous leprosy, you add clofazimine,
Okay.
300 milligram once a month plus 50 milligram daily for multibacillary cases for 12 months. This is for 6 months.
Okay.
However, the WHO, after carrying out various trials in Bangladesh, China, India, Brazil, advises that multi-drug therapy uniform should be given. All three drugs should be given for a period of 6 months.
Okay.
The two reactions that can develop in tuberculoid: reversal reaction, that is delayed hypersensitivity. It can develop any time during the course of the treatment or even after. And at that time, the lesions increase, they become more painful, especially on touch. And
Okay.
the treatment for that is steroids. There's another type of reaction called the erythema nodorum leprosum. There, the lesions increase in size, they're very painful, and there, thalidomide is the drug of choice. Uh, but it should be used very carefully in young ladies, because if they become pregnant, it can affect the child.
Okay.
Otherwise, with or without steroids, that is the treatment. Coming to the complications, these are the two reactions that can develop, or there is a third type of reaction called the Lucio phenomena, which
Okay.
can cause thrombosis and infarction of the overlying skin. The skin becomes black. Then I told you about erythema nodosum leprosum, which has to be treated by thalidomide.
Mm-hmm.
Reversal reaction, ENL, and Lucio phenomena.
Phenomenon.
Deformities and permanent nerve damage can occur. Corneal ulcers and blindness can occur. Systemic involvement and infertility are all other complications that can occur. They keep on, even after treatment, their sensation is less in the hands and legs, so they keep on getting injured and the healing
Right.
may be affected.
Mm-hmm.
Prophylaxis reduces the risk of leprosy, showing a variable efficacy from 20 to 80%, which I mentioned. Revaccination of household contacts with BCG also provides protection, especially against the multibacillary type. Chemo prophylaxis of contacts with single dose of rifamycin reported a benefit, albeit for a short duration, and in about 80% of patients. And these
Mm-hmm.
are uh, multiple trials with the BCG vaccine and
Right.
how it reduced it by about 50 to 80%. So, in conclusion, giant strides have been taken worldwide for eradicating or reducing the incidence of Hansen's, especially with the efforts of WHO, but still there's a long way to go in tropical, subtropical regions. You already asked me: improve nutrition, reduce poverty, and therefore socioeconomic status. Improve the socioeconomic status. Vaccination and chemoprophylaxis, which I discussed.
Right.
Early detection is mandatory, and investigate and treat the disease very early and adequately. Reduce
Mm-hmm.
the stigma, which you again asked me, and
Right.
prevent spread in contacts, and even prevent complications after the treatment.
Even after treatment.
Hmm. Thank you very much. So this was in short short, the leprosy as it presents to the neurologist and how we should handle the same. Thank you for asking me to speak on leprosy. Uh, and I think with the interview, which you asked me very nicely, and the slides, it probably covers most of it.
Thank you so much, Dr. Nitin, for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
It's my pleasure.